Hi, this is Therapy with Buzz. Hey, listen, let me ask you a question. All of a sudden, you start feeling down, and maybe you don't exactly know why you're feeling that way, but there could be some legitimate reasons. But you want to know, am I depressed? Because there's a difference between feeling down and actually being clinically depressed. And I want to go over that with you today. Well, first of all, a lot of people experience these losses in life. You might lose your job. Some people, and I spoke in the last a video about grief. It's interesting because if you get a bereavement leave from your work, they don't give you 2 months. They give you like a couple days. So normally feeling down, they're expecting you're going to bounce back and at least do your work. Maybe you got bad grades in school. Maybe things are not going really good between you and your partner. These things can cause you to feel down. Sometimes people get just some bad breaks, especially when it's not their fault. Sometimes it is, sometimes it's not. But when you get a series of these, you start getting in, I guess they'll call it a funk. I'm just in a funk. Now, let me kind of explain the difference between that and clinical depression. Clinical depression typically it has to be over time. So you got to be dealing with that for about 6 months or in that range, that you felt down. You've had this down feeling. It also affects your ability to function over a long period of time. For example, you may not be able to go to work anymore. Maybe you were given a leave of absence from your job for a period of time, maybe on some sort of a disability, or maybe you can't go to school and you've begun to stop going to school for a period of time. Also, people eat too much, eat too little during these periods. So there's a number of things that we begin to look for. The number one thing we look for, though, is a person's inability to function. And usually when that happens, they're going to need evaluation for sure, and they may need they may even need medication, because the big thing is this depression something you can do talk therapy with and to help alleviate it or eliminate it in the case, or is this something more organic in the brain, that your brain chemistry is creating this? For example, if you can't think of anything in your life that's really causing this, but you're feeling down for no particular reason, sometimes we have to go to the organic stage, which means psychiatry and perhaps some medication. Medication doesn't always have to be long-term, but that's just the difference. So what I want to know from you is, are you feeling down? And how long have you been feeling down? How bad is it? Also, if you're a person who's already getting counseling and maybe getting some medication, how long have you been doing this? The one thing I noticed over the years, and something I've been able to help in the last 10 years, is a lot of patients use their medical insurance for a while, but then after a while, your medical insurance company doesn't give you sessions anymore. Because what happens is, as a therapist, when I used to apply for medical insurance for my clients, they would reject it, and then I had to fill out an appeal paperwork. Well, maybe the first time I did an appeal, I won, but sometimes the second appeal, I didn't win. So what are you going to do? You got to go to your therapist. Well, that could cost a lot of money. So what I've done, in the last number of years is I started a small practice. Number one for reason is that people can continue to deal with the things they're struggling with over a period of time and not have to worry about having an insurance company approve them. Charge cash. It's a very, very minimal charge. You charge $40 for a 15-minute session. It's about less than half of what anybody else would charge you in the market. And I've been practicing a lot longer. I mean, I've been practicing since the early 90s. So obviously, I've treated almost every kind of condition out there. I really do a lot of work and have done a lot of work in the area of mood. Mood being depression, anxiety, bipolar, OCD, obsessive compulsive disorder, all those kind of things, panic attacks. These are kinds of things. I've also done a lot of work with addictions, because No, almost everybody that has an addiction probably is a dual diagnosis, and more than likely, most of them struggle with mood disorders. So this is what I've been doing mostly during my career. But maybe you're at the beginning phases, and maybe you're simply asking the question, Buzz, do I have clinical depression? Now, if you like, you can contact me. For the price I talked to you about earlier, you can contact me at helpbybuzz12@gmail.com. I do my counseling online. I report to no one, which is good because I don't report your medical history to any insurance company because as much as they tell you it's supposed to be confidential, surprise, surprise, there's a medical information bureau that has your information. Could they use it against you? Yeah, maybe in insurance cases they might, but it's information that's not kept confidential. The other issue is getting out of your house, going to a public facility, sitting down, seeing your neighbors also there, going in. Everything that you say is written down and seen by many people. Seen by intake workers. It's seen by your therapist. It's seen by everybody who works there. And if you're going to a local place, more than likely people that are there might know who you are. And maybe you don't want your information out there. Maybe you want true confidentiality where nobody knows nothing about you. I can guarantee you that. So certainly, if you want to do something like that, feel free, contact me. I'll show you how to get started. I do Zoom. I even do a Facebook Messenger with a lot of my patients. Whatever floats your boat, whatever's easiest for you. Now, that'll give you a little help. And also, I think it's important that if your depression is serious, or if it's certainly clinical depression, that you may want to have a psychiatrist on board for sure. And also, if you've never been treated before, of course, you probably can potentially get therapy on your insurance. But how much is that going to cost you? Some insurance co-pays are $20 and $30. So I'm not much more than that, really. And so I try to keep my prices to the point where it's affordable for most people. Because let's face it, in the United States and in a lot of countries today, money's tight. In fact, money's maybe some of the reasons why people are down, because they're struggling and they're stressed out. And that might be the big part of the problem. So the last thing they need to do is blow a lot of money on something that that may or may not get better. I understand that. But one visit might be able to help you. I can at least give you an idea of number one, if you have clinical depression, and I could get an idea how bad it is, and I could give you some advice about where to go from there. Hope to see you next time. Now, look, please keep me online. Hit me up my subscriber area, and also hit up the like button and the bell, and you'll catch me on the next time around. And if you need help by Buzz12@gmail.com, and we'll see you next time. Take care of your mental health. Okay, we'll see you.